Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Safety and the Older Adult, Episode 3, Smoking Safety. After viewing this episode, participants will review fire hazards associated with smoking. Participants will also learn strategies to help older adults reduce fire hazards associated with smoking. And finally, participants will learn about cessation resources available to older adults.
Careless smoking is the leading cause of death and the second leading cause of injury and fire injury in people greater than 65 years old. So again, that's a huge number. So between cooking and smoking, the elderly population is at risk for fire injury and fire death. People between the ages of 65 and 74 are twice as likely to die in a fire than any other age group in the American public.
Being that I've been a firefighter for a number of years now, I can definitely remember quite a few calls, some more tragic than others, but many near misses, usually revolving around alcohol, which is underestimated. Sleeping in bed. Sometimes it's alcohol and then sleeping in bed with smoking going on at the same time. There are occasions where people will just not have the means to properly dispose of, or not even care to properly dispose of, a cigarette.
Many cigarette brands will publish the fact that they're self-extinguishing or they go out by themselves. That's not the case. They certainly don't. And a cigarette dropped into a couch cushion, dropped into bedding, could easily ignite and cause serious fire. And that has to be addressed. Falling asleep with your smoking materials will produce injury. There's no doubt about that. So smoking safety in all communities, especially in the senior community, is very important to us. People who are on home oxygen continue to smoke, and that puts them at risk for flash burns to the face and airway. And the problem is that oxygen, although it's a non-flammable compressed gas, it is an oxidizer, and it will support combustion, and it will enhance the burning of any flame, including a lighter or a cigarette. And that's really where we see these patients. They'll have their nasal cannula on, and they'll put the cigarette in and flick the lighter and light their face on fire, singe their hair, singe their eyebrows, burn their nose, burn their mouth, and that can lead to serious injury as well.
Smoking is the leading cause of death and the second leading cause of injury in fire-related incidents. A cigarette that is improperly extinguished can easily start a fire. Smoking in bed and alcohol consumption while smoking place individuals at increased risk for starting a fire.
Some ways that EMS providers can help limit the injuries associated with geriatric smoking, first of all, involve understanding the pathology of the aging process and the use of medications and alcohol. Medications and alcohol obviously can make someone depressed, sleepy, and could make them prone to falling asleep while smoking. So if someone is on a new medication, had a medication change, or is using alcohol, EMS should discourage them from smoking at those times to help reduce injury. Falling asleep while smoking can ignite clothing, rugs, other materials that can cause a fire in the home and obviously injure the person. Now, if we're talking about a senior living community or a group home, now we could have multiple casualties, not just because of the thermal injury from exposure to flame, but more, the larger problem will be exposure to the products of combustion, the smoke, cyanide, carbon monoxide. And it's important to remind everyone that cyanide is as prevalent in the products of combustion as carbon monoxide. And for years we thought carbon monoxide was the big killer of people in fires. Well, in fact, cyanide is present in very high concentrations in ordinary combustibles, and that is a big concern for us in the resuscitative phase as well. If the person is going to smoke, we should suggest that they use a very large, deep ashtray and make sure that their smoking materials are extinguished fully. We should also make sure that they're discarding their waste materials, their ashes, after they've completely cooled, after they're completely extinguished. Improper discarding of ashes and smoking products into a trash can cause a fire. I should say will cause a fire. Don't walk away from any lit cigarettes, even if it's just to answer the phone or answer the doorbell. Extinguish your smoking materials or take them with you. Left alone, left unattended, fires can start. Animals could cross over the cigarette, knock it into combustibles, could be blown off, could be knocked off. It doesn't matter. Don't walk away from a lit cigarette.
As a social worker, I have seen the effects of what smoking can do to people. I've seen people who have injured themselves because of smoking in bed, injured their children because of smoking in bed. I have seen people who have ended up with lung cancer and seen what the disease does to their body because of smoking. That a strong person one day, the next day isn't able to care for themselves. And to see the effects of it and how it can destroy families, it's just incredible. Even at a late age, it's important to quit for many reasons. One, make your life a little bit longer and hopefully make those last years a little bit more pleasant. I will say that I had a great aunt who smoked her entire life. She even got to be in her 80s. She was on an oxygen tank. She needed oxygen because she smoked. She would turn off the oxygen tank and light up her cigarette and then turn it back on. Now, she fortunately did not harm herself, but there have been instances of older adults who will continue smoking on oxygen, forget that the tank is on, and then injure themselves. It is difficult to get an older adult to realize what they're doing, but the amount of older adults that will forget that they've lit a cigarette or fall asleep with a cigarette and then end up burning themselves, injuring maybe their loved ones, themselves, their pets. So it can be quite devastating, the effects from smoking. And it is difficult. It's not going to be easy at any age to quit smoking, but more so in the older years because they've been smoking for so long. But there are resources available to help them stop smoking. The hospital at Strong, we actually are pushing to ending smoking. Parents who smoke, we are giving out free patches to parents who smoke to hopefully prevent SIDS in newborn infants when they go home, because that's another effect that smoking can cause. So in order to get help and where to get help, I would say definitely your primary care physician is able to help you and write patches. If you're on a limited income, or even if you have insurance, New York Quits is a great organization. They will give you free patches. If you are someone who has Medicaid, they will give you about a month's worth of patches. And if you have insurance, they'll still end up giving you about 2 weeks worth of patches and additional support. New York Quits can be accessed either online, they have a website, or you can call them on a 1-800 number. And again, they will provide the patient with resources to stop smoking.
There are a variety of services available for smoking cessation, including primary care physicians, Medicaid, New York Quits at 1-866-697-8487, and hospital-based programs. After viewing this episode, participants will review fire hazards associated with geriatric smoking. Participants will also learn strategies to help older adults reduce fire hazards associated with smoking. And finally, participants will learn about cessation resources available to older adults.